So what is the most important conversation that you need to have as a chiropractor with a medical doctor in order to not lose a PI patient? Okay, and we'll just get right to it. The number one thing that you need to do is discuss the expectations up front. Too frequently, we see doctors who are trying to do PI right, who are trying to build a referral network. However, for whatever reason, they haven't put in the work, the due diligence, and actually built a rapport with those physicians that you're referring back and forth with. So it's going to be extremely important to set those expectations right up front. So what does that look like? When you are meeting with a new medical doctor or maybe an existing doc that you already refer patients to, it's going to be crucial that you have that conversation and explain exactly what your expectations are. First and foremost, clearly it's going to be excellent patient care, but on a purely business side, they need to understand that anytime that you refer a patient out to them and to their clinic, they need to be tracking those statistics. They need to know where those patients are coming from and that they're coming from your office, and that patient needs to be returned to your clinic. On the flip side, they also have to understand exactly what you do, and if you've been networking with and actually referring to other healthcare providers frequently, they will have a good idea of what you do and what you specialize in. They're going to get feedback from the patients. They're going to get feedback from your staff, your team, yourself, with some of the patients that you guys are co-managing together, and they will get a good idea of what are the right patients, the right pathology, the right patients that they can refer into your office for the best care, okay? It's important to understand as the chiropractor, you have a ton of leverage in these scenarios, and when you lay out your expectations explicitly up front, it's gonna help build a rapport, it's gonna help make sure that that patient gets what they need on the treatment side. And from a pure business perspective, it's going to ensure that you are getting your patients back and an influx of new patients over time. Again, if you're building that rapport with the medical provider and their team and their staff, and doing all the things that we do every day, caring for our patients and communicating that properly back and forth with those other healthcare providers. So again, the number one sentence, the number one thing that you need to realize in order to not get a patient poached is to lay out your expectations up front. Hi doc, here's what I want to do. I would love to utilize you for this specific service. Here's what I'm expecting. I need my patients sent back to me at all times. And if you have patients that could use our services, please do keep us in mind. You will tell over time how we co-manage together and how we are both going to work together to get those best outcomes. And for personal injury specifically, that's how you do it right. You work with a group of providers with a common cause, each with their own specialty, in order to really get that patient what they deserve, to diagnose things properly, and to make sure that you guys are coming together as one to really show, whether it's the patient, the legal community, the adjusters, or anybody else, that you understand how to work up things properly. So my name's Dr. 𝒂𝒒. If you have any more questions, please go ahead and look us up at PIExpertsecrets.com. We have a ton of information on our site that you'll find extremely valuable.